Welcome to Verified RX, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
The Vizient Pharmacy Vision Awards are in their third year and advance pharmacy practice through forward thinking and an eye on the future. Applying for the awards is easier than ever. And joining me today to talk about the process are Dr. Korte, Senior Director, and Dr. Stephen Lucio, Senior Principal, my colleagues at Vizient. I'm Gretchen Brummel, Pharmacy Executive Director with the Vizient Center for Pharmacy Practice Excellence, and your program host. Welcome, Katie and Stephen.
Hi.
Thank you, Gretchen. It's great to be here.
Well, we're pleased to have you both here on the podcast today. Stephen, our listeners know you very well. Katie, please tell me a little bit about your background before you came to Vizient.
Thank you for having me on today, Gretchen. Prior to Vizient, I was at a hospital in Kansas City, Missouri. I completed residency training, specialized in critical care, spent a couple years at the bedside, and from there moved into a couple of different roles between clinical manager and director of pharmacy for both our inpatient and our outpatient pharmacy program. I came to Vizient last fall, and it's been a wonderful experience since.
Well, that's a great background. I'll be interested to hear about your experience both as a member and then now on the Vizient side of things. What are the Pharmacy Vision Awards?
Gretchen, the Vizient Pharmacy Vision Awards is our program to recognize and celebrate the significant contributions our pharmacy colleagues, both pharmacists and other pharmacy professionals, make every day to improve patient care within their institutions, support financial success, and ensure that pharmacy delivers on its ability to influence and affect the best clinical outcomes possible. One only has to look at the amount of healthcare expense associated with medications. Managing that financial investment while also ensuring access to care across populations are tremendous responsibilities. Before, during, and since the pandemic, pharmacists and pharmacy professionals have had to fulfill these expectations against greater and greater challenges. It's only appropriate that we provide a forum to recognize those contributions and to enable others to learn from them.
I could definitely see the need for this type of award. Katie, given your more recent experience in direct patient care, can you share a little bit about what it's been like to not only survive but thrive in clinical practice?
That's a great way to put it because it truly is finding a way to survive and thrive right now for a lot of our members. I still remember back to March of 2020 when everything slowed and it seemed like everything was shutting down. We went from a space of being incredibly busy and having back-to-back in-person meetings to suddenly everything's getting canceled. COVID hadn't quite come to Kansas City yet at that point in time. What we did instead of becoming stagnant is our organization decided to get ahead. We took it as an opportunity to develop a pandemic response guide, go through medication allocations, and figure out how to come up with our program and our process through this moment, which was a very defining moment in healthcare. When things ramped back up, we found ourselves having to do more with less money and less people. That's where we found ourselves not only in survival mode, but we were thriving because of the steps that we took to get our department in a place where we needed to be during these challenging times.
And Katie, you just gave a great example and why you deserve an award just for that, because that type of ingenuity and innovation, not wasting a crisis, but using it to elevate practice and prepare for the next challenge, that's exactly the type of spirit that these awards are intended to celebrate, to recognize, and provide a circumstance where others can learn from. They can replicate and build upon great successes. A lot of what pharmacy does, pharmacist technicians, sometimes it's behind the scenes work. It may not be the most obvious thing. Sometimes it is. Helping that recognition to take place and being able to celebrate those contributions and to help further characterize them is part of the spirit of these awards that we've tried to endow and then continue going forward each year.
Well, let's get into it. Tell me more about the specific categories within the Pharmacy Vision Awards.
The number of awards that we have, 11 different categories, speaks to the diversity of ways in which the pharmacy audience affects and impacts patient care and the success and opportunities for health systems. We have certain groupings when it comes to the awards process. Some of the categories such as excellence in pharmacy sourcing, excellence within our pharmacy aggregation groups, more focused geographic sourcing, excellence in clinical practice, and excellence in innovation, somewhat fit around the traditional areas that you would think of pharmacy practice. How do we manage the supply and the stewardship around medications? How do we advance clinical practice? And how do we innovate, address new situations, and help improve the efficiency and effectiveness of care? And then we have some other awards that are focused on that whole element of performance improvement when it comes to areas where members have partnered with our performance improvement teams, our consulting teams, and utilize the analytic programs that Vizient has to make improvements, make enhancements to transform their organizations. Another critical category are a couple of areas that have become so important to practice that weren't historically a part of the health system experience. One of those is managed care. As this audience understands, it's no longer just what happens on the medical benefit side or just within the area of what you're doing with your patients, but how you're managing the pharmacy benefit of your patients or your actual employees is an increasingly important role for our member organizations. That's why we have a managed care award. And then with the pandemic and every other circumstances, I've been excellence in advocacy and public policy. There's frequently occasions where we say, oh, whatever challenging event, it takes an act of Congress to be able to get something done. Well, sometimes it actually does take an act of Congress. And some of our members have made leaps and bounds of success, whether it's at the federal level or at the state level, trying to influence legislation and regulatory requirements so that way we can remove burdens that prevent the practice of pharmacy from being as effective as it can be. Whether you are an official leader, and that's within your title, really pharmacists and pharmacy technicians have taken on leadership roles, both during the pandemic and before and since. We recognize those tremendous contributions with our excellence as a pharmacy professional, so you don't have to be a pharmacist to be recognized, our excellence in executive leadership, because many of our senior pharmacy leaders are not just leading hospitals, but they're leading these entire programs and enterprises that span this huge continuum of practice. And then the last thing is one of the biggest awards, our Strategic Transformation Award, because pharmacy is very important for an ever-increasing aspect of care, but contributing to the overall strategic relevance of the organization is an essential element of what pharmacy is currently and what it will be in the future. Being able to recognize members individually or their organizations in total for achieving that transformational effort across their organization and in concert with other departments is extremely relevant and why we choose to recognize it. There's a huge array of topics that people can nominate themselves or others or organizations to champion and to celebrate all that pharmacy is able to accomplish.
Yes, lots of diverse and great opportunities to be able to raise up your work to a national audience. So I appreciate that description. Thank you. Who can apply for or submit a project for consideration for the Pharmacy Vision Awards?
The great thing about the Pharmacy Vision Awards is that any Vizient member can either self-nominate or nominate their peers. If you know of anyone out there who's doing really great work on a day-to-day basis who may not apply themselves, make sure you're out there nominating your peers and your colleagues, because this is basically the pharmacy Oscars, right? Let's make sure that everyone out there who's really putting in work to change the field of pharmacy and make an impact on patient care, that we're able to recognize them.
I love that concept of the Pharmacy Oscars. So when are you accepting submissions?
We're accepting submissions starting May 1st, and that submission window will remain open through June 30th. And there are some criteria to be aware of when submitting for these awards. Some categories do have minimum qualifications. For example, an organization needs to be a member of an aggregation group to be eligible for that specific award. Those details, though, are available in our promotional materials and specifically in the overview document. Projects can only be submitted to one category. As you review those categories, be sure that you're picking the category that is the best fit for the project that you have worked on, and ensure that you are meeting that 2,000 character limit for each submission.
Well, that's a nice level of detail for folks that are considering submitting, and we'll be sure to link to that overview document in the show notes for people that want more detailed information. When should we expect to hear about the winners of the Pharmacy Vision Awards?
We're going to announce the winners in the August timeframe towards the end of the summer, and then we have a winners reception at our annual Vizient Connection Summit in September, which is a great opportunity to celebrate these various accomplishments.
I'll be sure to mark my calendar. Why should someone consider applying for the Pharmacy Vision Awards?
There's a lot of work that people have to do, and it's quite a challenging time. So there may be some thought that, okay, you're asking me to submit another document that I have to fill out and characterize something that I've worked on. And yes, that is exactly what we're asking you to do, because what you are accomplishing is incredibly important, especially given the challenging circumstances that all providers are having to face. You, as a pharmacy professional, as a pharmacist, an individual practitioner, or a leader, are continuing to make monumental contributions to healthcare each and every day, and those need to be characterized, they need to be memorialized, and they need to be shared, because many people face the same challenges, and there's nothing like being able to help someone else with something that you have done and been able to demonstrate success with, and improving the financial performance of your organization, the extent to which you can provide access to care, and just improving the overall circumstances of the patients that entrust themselves to your oversight and your protection. Please, if at all possible, if you could contribute, we appreciate every submission. And even if your submission is not necessarily selected as the actual award winner, we still use those submissions to help identify topics for continuing education, other experts to help us with all of the work that is ongoing within Vizient, because there's always strategic projects that can be amplified given people's previous experience around that same situation. Let us have the opportunity to learn from you and possibly celebrate and recognize the great contributions that you are making each and every day.
I couldn't agree more. I think it's absolutely vital to get those pharmacy success stories out there on a national stage. Katie and Stephen, thank you so much for joining us today to share your perspective. I'm so glad you could be here.
Thank you, Gretchen.
Thank you very much.
And listeners, please join us for more Verified RX podcasts. Subscribe today, like us, and send us your comments. We'd love to hear from you. Verified RX is your prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. I'm Gretchen Brummel. Thanks for listening.